Welcome to True Health Tuesday, and the truth will set you free. Today is exciting. We're going to talk about the wrist and the hand, and it's huge. Number one, you've got to get the nerve supply going. This is with everything in the upper extremity. You've got to clear from the cervical spine. You've got to restore that curve to correct the forward head carriage. You got to correct the acromioclavicular joint. You've got to correct the sternoclavicular joint, glenohumeral joint, radius, ulnar joints. Okay, correct all of that stuff, restore the curve. And then you've got to correct that cervical spine, more important than anything when you're working on the upper extremity. Now, when you look at this, and the brachial plexus comes out of the base of the cervical spine, that's why you've got to restore that nerve supply first. And one of the most brilliant doctors, Dr. Jacobson, said to find out what's wrong with somebody, you got to do two things. One, ask them to listen. And people will show you, they say, Doc, it hurts just like this. That's the sixth cervical nerve root. I know exactly where that's coming from. So look at the dermatomal pattern, and this will clue you in to the level of the cervical spine that's actually the issue. Then you got to look at the forearm, okay? The muscles that flex the hand and muscles that extend or open the hand should be a 5-to-4 ratio. This is why when we cover the elbow, we talk about the muscle imbalance and how all the flexors, the ones that close the hand, are attached to the medial epicondyle, which is the inside of the arm, and the extensors are attached to the lateral. So you have to look at any kind of muscle imbalance of that elbow is going to directly affect that wrist and hand. Now, when we look at the bones of the hand, you've got the carpal bones, which are fantastic. And you're thinking they're mobile and strong. Then you have the phalanges coming off of those. And it's interesting when you look at the names of the phalanges. Pellicus means police or strong. Indicus for indicating things. You're looking at vulgaris, annulus, and auricularis. So they have names, but also the muscles attached, the deep muscles attached to the distal phalanges, the muscles on the superficial aspect of the forearm attached to the proximal one. So all the muscles can attach, and you have to look at their function as well. Now, there's a variety of wrist injuries that occur, especially from impact traumas. That's why you have to look at an X-ray. And the most common one is that scaphoid fracture, and that's going to be in right behind the thumb in what's called the anatomical snuff box. And when you look at the scaphoid, there can be a fracture of it. And if there is a fracture as indicated at this X-ray here, that can interrupt the blood supply, and there can actually be necrosis or deadening of that bone. This is why, and you'll see that present if there's been a long-term damage to that wrist, you're going to see a whitening of that bone, and the most common. And this is why you've got to take an X-ray to see what's wrong. Now, I use the tuning fork all the time. A tuning fork can identify, and it's called tuning fork oscillation test. It might seem primitive, but what's really cool is that vibration. If there is a separation or a fracture, it's going to vibrate those two ends together, and the patient will feel it at that level. This is fantastic for rib injuries and any type of extremity injuries, but also to identify the carpal bones to see if the lunate or the scaphoid, which are the most common ones, the scaphoid is the most common fractured one. And the 128 hertz is the best. And you're going to see it's to identify a fracture. The accuracy rate is 75 to 90%. And even if you do not get a positive test with that tuning fork, take an X-ray. Now, the most difficult types of fractures to identify are hairline fractures or stress fractures. Now, this is hugely important because there are little cracks in the bone that you can miss on X-ray. And there's an outside covering of that bone called periosteum. And there's a fibrous collagen layer, and this is also can be injured in what's called a bone bruise. Now, this periosteum can actually swell up and hide a fracture on X-ray. It can also hide it on MRIs as well. So the first 24 to 48 hours, while that periosteum is swelling, may be very, very challenging to identify with it. So, if you've taken an x-ray immediately after an acute trauma, uh, you know, trust it a little bit, but don't trust it a lot. Always, always, always double check. Now, take note of any conditions the patient is suffering from, such as rheumatoid arthritis, medications, particularly nonsteroidal anti-inflammatories, injections, surgery. Now, cortisone injections in the wrist are extremely common, and this can cause tremendous damage to the wrist. That's when they actually limit the cortisone injections. They say you can do no more than 3 shots in a joint. Conditions such as lupus or rheumatoid arthritis, it's very common to see a deviation of those fingers where all the fingers are bent at an angle. Now, an interesting fact about this deviation of the fingers is that if you take an x-ray, the joints are usually in relatively good shape with very little deterioration. Now, here's a patient with a diagnosis of lupus for over 30 years. And of course, he was treated medically, where you get the steroids, anti-inflammatories, pain relievers, all of that. And none of those are going to help the cause of it. But even though his fingers were horribly distorted, you can see the joints are in pretty decent shape. And so this is huge. When you look at that long-term deviation, if the joints are in good shape, you can start to change that by, again, restoring the cervical spine and all of the joints that lead up to the wrist and hand. Now, when you look at the rehabilitation exercises, many chronic issues such as lupus, rheumatoid arthritis, any person that's received steroid injections, this is going to lead to tremendous stiffness and tightness in the joint because it literally destroys that joint cartilage. And it is an anti-inflammatory, but inflammation is the healing process of that wrist. So some of the stiffness is due to the negative effects of the steroids. But another factor is if the pain, and the patient has been in pain for so long, they're afraid to move their wrist. So they're going to lock in the wrist because of anxiety, because they know every time they move it, it hurts. Now, when a person has been suffering for many years, they're going to be very scared to move this. And a simple exercise to alleviate the pain and fear of movement. Now, this is ideally you're going to use a kettlebell or a weight. A lot of times I'll have the patient laying in the supine position and I'll just have them grab my finger with their fingers and I'll pull it down to show that they can have a distractive force without causing discomfort. Now, the weight must be proportional to the patient's muscular build. Like 5 pounds would be for a very, very small person, 10 pounds for a little bit an average person, and for a very muscular, strong person, 20 pounds. But you need enough weight to open up that wrist by applying a distractive force on the carpals and metacarpals. Now, when you're placing this wrist, you do not want to hand the patient the kettlebell. You want the patient standing up and their arms resting at their side. And you're going to be placing this weight in their hands and even curl their fingers around it. And so that they can be assured that's supporting the weight. Now, this weight is going to distract this. And they're going to hold the weight by their side so they're not going to be swinging their arms. A very, very small amount of movement. And I mean very small, because you want to create that distractive force, and the movement is going to be just so little, but that little bit of movement is going to create a negative and positive pressure in all of the joints of that hand and wrist, and it's going to create new fluid production or new synovial fluid production. So you'll see here my patient's hand is moving a little bit towards the body, a little bit away from the body. So almost imperceptible movement, but they're going to get used to moving it. And this is the very first time this patient's using this lateral distractive flexion and extension. And as they do this more, they're going to develop more and more mobility of the joint because you're getting more and more hydration to those joints. And now have the person move it laterally and medially or away from their body and towards the body. Now, this exercise is not for the muscles, but rather to create a negative pressure to draw fluid into that wrist. Now, keep in mind, all the joints of the body are hydraulic and they get their fluid through movement. Now, the goal of this exercise is to hydrate the wrist. And then also, instead of away and towards the body or lateral and medial movement, we want to move it anterior and posterior, front and back. So just that little movement, anterior and posterior, backwards and forwards, it's going to be so simple, and so easy because it's all done under distractive force. Now, after a few minutes between altering flexion and extension, forward and backwards, take the weight from the patient's hand. Now, do not let the patient hand you that weight. Okay, that would cause intense discomfort. So keep them by their hands by their sides, and you go up there and take it away from them. Do not let that patient hand that weight back to you. Now, this exercise is absolutely fantastic for people that present with those deviations, those medial finger deviations. Now, not only will it help with proper aligns the fingers back to the neutral position, but it helps strengthen and builds the healthy tissue. So you're literally going to be remodeling the cartilage. You're going to be remodeling the ligaments. You're going to be remodeling the tendons because those muscles attach to the fingers. So you're going to be completely changing also the sensory input from those joints into the brain. This is the key in regeneration. Now, make sure that when you're using this, that you have a qualified chiropractor or qualified healthcare professional that's familiar with this. Now, next week, we're going to dive deep into carpal tunnel syndrome, causes, and several solutions as well. So when we talk about proper nerve supply, you can see how important it is when you're talking about any deviation in that upper extremity. And I'm talking rotator cuff issues, golfer's elbow, tennis elbow, and wrist issues, finger issues, everything. Regular exercise. You need to move those joints, particularly when you're talking about wrist and hand injuries, under a distractive force. And this is going to make a huge difference. You move every joint every day, you got a healthy body. Proper nutrition. This means your diet is going to be like your great-great-grandparents. Healthy, organic, seasonal, varied. Sufficient rest, because that's when your body regenerates, and prayer and meditation. Absolutely fantastic. Now, make sure you put your questions down below. We'll get to as many as we can. And we've got to divide the questions up into two sections. One I can put on the standard social media, and then one we'll put on our private site, because there's certain things that you cannot say. God bless you all. Know that your body is alive. Even distorted joints are alive, and they can remodel. Stay healthy, my friends. God bless you all.